What's mental health?
He asks all the questions everybody wants to know.
It basically includes our emotional, psychological, and social well-being.
You're driving me half out of me mind, you crazy old coat.
It affects how we think, feel, and act.
Oh my God.
Not just that, mental health helps to determine how we handle stress, and other things as humans. The Mind Clinic, a platform where people can talk about issues directly or indirectly on mental health.
Chinyarugo dances in the studio this morning. Good morning to you.
Good morning.
My name is Victor Peppo. The Mind Clinic comes to you every Wednesday at 8 o'clock. We understand that mental health is important, and that's why we have these conversations every now and again. It's a conversational program, and we give you the opportunity to get to call in, ask questions, and contribute to the topic of discussion. You can also leave us messages on the WhatsApp portal. This month, we're discussing investing in mental health. And I think this month as well has something to do with mental health awareness.
The Mental Health Awareness Month. Well, 10th of October is the World Mental Health Day.
Mm-hmm.
So for the whole month of October, we're discussing mental health because it's like the mental health month.
Exactly. And you must invest in your mental health. It's important. Not too many people know about that. On the show today, we're looking at investing in your mental health as a family and a community. Our guest on the program this morning is a trained teacher. He's worked as a secondary school teacher and learning mentor, a social worker, behavior improvement practitioner, community mental health support practitioner, and interpersonal skills development both in the UK and Africa. He has a degree in sociology, social welfare administration, a specialist graduate certificate in social work, and a postgraduate certificate in interpersonal conflict resolution and meditation studies from the University of London and Institute of Family Therapy in the UK. He runs Insights Training Services in Abuja, focused on affordable and practicable transferable training in social and emotional learning, interpersonal conflict coaching, that's doing conflict constructively, developing peer and interpersonal mediation teams, lay counseling and community mental health support work. Our guest on the show this morning wears many hats, and we crown him the community mental health and lay counseling trainer. Yomi Oloko is in the studio this morning.
Wow, good morning. Hope I can live up to that introduction.
Thank you very much for joining in.
Yeah, thank you for making your time available to join us. Like I said to Victor earlier, the conversation for this month is all about investing in mental health.
Yeah.
In keeping with the theme of the WHO mental health conversation. And also, if we had to look at the pandemic, this is more reason. The COVID pandemic has shown us that there is more reason for us to invest in mental health. Last week, we talked about investing in mental health as an individual. And this week, we want to step it up a bit and look at it from the family community perspective. So before we even get into the conversation, what is your thought on the whole conversation of investing in your mental health as a family and as a community?
Well, I think it's long overdue. My general observation is that we've been in a lockdown now for over 6 months, and there's been lots of social issues, and I am wondering, why do we expect that people will not be having an increased level of depression and anxiety as a result of this the COVID-19? So I think it's long overdue to have that discussion. People have been locked up together in families and small communities, and lots of things have been happening.
Yeah. So when it comes to mental health and mental well-being, what is the role of the family?
Good question, and I've been thinking about that, so I'll keep it very simple. I think the family is the primary basis where a lot of us get our social interaction and our intimacy and all other things. So I would say the primary role of the family in relation to mental health is being a safe space for developing resilient skills, and being a safe space where individuals can come and discuss mental health issues without being judged or feeling that they can't open up.
Yeah. And how about the community?
The community does, Well, I think I would take the community at probably the local government levels, because that's the main level that a lot of us have interactions with. So I think the community at the community level, they need to create levels of support where people can go to talk, be listened to, and actually have some form of therapy or other mental health interventions that are needed. So I would say that very important that the primary healthcare centers should be seen as a very important tool at the community level.
Yeah. Seeing that you've worked with communities in Nigeria, where are we if we had to talk about investing in mental health?
If I'm honest, I know some people have said, Nigeria, we have a very good mental health provision, but I would say actually we are falling short. We are not providing Nigerians the level of mental health that is needed, mental health support that's needed. Just before this program, I went on the Association of Nigerian Psychiatrists, the website, it's in the public domain, and they have 250 psychiatrists in Nigeria at this present time, and another 200 in training. And I'm sure most of those will leave for greener pastures. So we don't have enough facilities in country. And we also need to look at developing grassroots level answers. Yeah.
Do you want to just give us more information when you say grassroots level answers?
Okay. No matter what we feel, we can never train enough psychiatrists. We can't. And we even have less clinical psychologists. As far as I'm aware, there are very few HND courses, OND courses, degree courses in counseling. So we need to develop teams of people who can be trained as grassroots counselors, lay counselors, mental health support workers, whatever we want to call them, to be able to be a tool primarily in mental health care centers where people can go to discuss and have a non-judgmental space for them to talk.
Yeah. I know when we were chatting outside and we talked about the difference between the advisory role and the listening role that a lot of people play here in Nigeria. I would like you to just expand a bit more on that too.
So I know that a lot of, in quote, counseling, quote, counseling that goes on in Nigeria today is actually either faith group leaders, elders, friends, that people go to talk to, and while it's good, I do believe that a lot of good counseling happens when we have somebody who is impartial, who probably doesn't even know the person, so the person can go and talk, because generally that's what they want to do, go and talk, be listened to, not necessarily given any advice, be it worldly advice or spiritual advice, just be listened to, so that person can feel they've listened. And a lot of people after that, they can move on. And if they do need advice, it has to be specialist advice as to where they can be referred on, and basic therapy, CBT and other things.
Yeah.
Now, we live in Abuja, it's a metropolitan city, and then people here in this urban area have an understanding about mental health, and we can talk about it. I had a stressful day at work, is telling on my mental health, or getting back home, how do I find work and balance and all that. But we seem to forget most times about people in the interiors, in the rural areas, who most times are abused verbally or physically by their husbands, kids as well, and it's telling on their mental health. Some of them do not even have anyone to talk to, and this is the month where we're creating awareness. Not too many people even know, about mental health as it is. How can we push, to begin to change that narrative, especially in the rurals? We've had these conversations every now and again in urban cities, and there's a bit of an awareness. We know about mental health, but how about the rural areas?
Yeah.
Okay, Sammy?
Yeah.
Okay. Again, I would argue that even in the urban areas, we are not actually that mentally so well off. You just look at how we get into arguments, fights on the road, and then back. How we have people have said Nigerians, we are social alcoholics. We are, we have a lot of domestic violence in homes. But in the rural areas, I take your point, and that's why I said that we need more lay counselors in primary healthcare centers. In Abuja, there are over, last count, there are over 500 primary healthcare centers spread all over Abuja. And I remember in September I offered to train free primary healthcare choose community extension workers because they're on the grassroots level. I'm still waiting for FCT, Primary Healthcare Board, to get back to me on that. So that's one way, because the facilities there are primary healthcare centers there. Nigeria has a very good primary healthcare system. We have community health extension workers that would be ideal to be trained as lay counselors. So it's about having the political will to do it.
Yeah. And I think also in listening to what you were saying, it's also about the lay counselors bring some level of step-down support to the communities.
Exactly.
Because you have less psychiatrists, you have limited numbers of clinical psychologists or even other mental health practitioners. You want to step down the basics to lay counselors so that they are able to be the foot soldiers that take the basic mental health support and provide your basic mental health first aid. And I know lots of organizations are doing it. You're also training lay counselors at Neem Foundation. We also train lay counselors to be the foot soldiers. And a lay counselor can be anybody, you know, just anybody that is willing to offer mental health first aid, mental health support to people within the communities, and they go through like training, and they're able to be of help to the community and to the society at large.
Yeah.
Okay. So let's look at how can families and communities invest in their mental health?
So families, and we're looking at probably nuclear family. So I believe that parents, children, you generally have parents, children. On a level, parents need to be open to accept that children, teenagers, it's okay for them to talk to their parents about issues they're going through. Parents need to be a tool for particularly among teenagers, young adults that are probably going to university or higher education. They need to be a tool whereby they say it's okay to fail, that failure is okay. We learn from failure so that when these young people go into institutes of higher learning, they won't get stressed. We know anecdotally there's an increase in suicide within university students. Parents also need to be role models. Yeah. We need to teach our young people it's okay to have conflict, but we can do it constructively. Parents need to show young people, children, good gender, balanced relations, so that the home should just be a safe space for members of that family to be able to talk to one another about issues they're going through.
Yeah. And the community? How about the community? How can we do that?
The wider community, as I said, wider community, we just need more resources, the more spaces where people can go to. And yes, faith groups are important, but we need more non-faith group circular spaces where people can go to, talk, hopefully get referrals on, develop user-led support groups. You know, there are a number of things we could do if we want to.
Yeah.
And a radio organization like this, talking more about it, getting it out there.
Yeah. There's a community in Zimbabwe where they have, I can't remember what it's called, something bench? I've forgotten what it's called.
That is actually the model that I'm using for our lay counts, the Friendship Bench.
Yeah.
And the Friendship Bench is an African-led initiative, so we can do things that's actually being used now in Europe and the US. It's been well researched, where they are training grandmothers to be listeners. And obviously they teach them also basic mental health, etc. And they teach them things about problem solving. So if Zimbabwe can do it with limited income, there's no reason why Nigeria can't do it.
Yeah. And it kind of also brings me to the point where it's the community response to a challenge, where we should also create communities where we feel accepted. Communities, you and I, community, the people around us. It does not have to be some extended it's just you and I, the people around you, creating an avenue where people feel safe to come and talk to you, where people feel safe to know that when they approach you that you will listen. And what that does is that firstly that removes stigma, that makes accessibility easy for people to say, oh, I'm going through this, and it's, it builds some level of trust in the community to know that your community will protect you. And because you said it's your primary socialization agent, the family and the community. So we want to build communities where people feel safe to speak about things and they will not be chastised because of their experiences. We want to feel included and supported in our families and communities. So if you're listening and you feel like you can, you want to be a lay counselor, you want to provide this basic support, mental health support, please reach out. And because anybody can be a lay counselor, anybody can provide mental health first aid. You just have to go through some training and you'll be able to provide them with the skills that you need for this.
Can I just add, however, so the friendship bench which I've been studying, the lay counselors are paid. And I think one thing that I'm finding in Nigeria is that we're too used to using volunteers where we don't pay them, or we pay them some silly amount of stipend and expect them to do work. So we need, agencies need to put money into this. There are people out there that would do work. They're prepared to volunteer, they're prepared to do work, but we need to give them some form of reasonable compensation for the work they're doing. So I believe in that strongly.
Great. Thank you.
All right, still part of the conversation in regards to investing in mental health. We see that for some people, on a daily basis, the everyday Nigerian gets to experience, quote unquote, we're in Abuja, so not like Lagos where you see large buildup of traffic, but you get pockets of that here and there. This is the morning, rush hour, people are going to work, trying to drop off the kids at school, and then road rage. Most times, you have the kids in the car, and someone is just trying to, get ahead of you, and you begin to, abuse the person, and you have kids in the car. You get abusive sometimes. Some other times it's at work, and then you are in relationships with people, maybe at home, or you have a partner. Emotional intelligence, where does it come in all of this, especially as we talk about investing in our mental health?
Okay. First and foremost, I would like to say that as a mental health practitioner, I'm a strong believer in the social and economic determinants of mental health. Those social issues we face, the challenges we face that stress us out, and then when we get back home, we have mental health issues. Funny you talked about traffic. I recently, a couple of years ago, I decided to take the decision of leaving Lagos. As a born Lagosian, I said, I've had enough of Lagos. I can't be spending 3 hours of my life to get to work and another 3 hours to get back. That's 6 hours. It is tense. It is stress. And we don't believe in all this road rage, but you see, it happens. So, and these are part of the social determinants, those pressures that a normal Nigerian has just to get to work, if they have work, getting back, relaxation, stress, the noise. So they all impact on our emotional and mental well-being. And when we talk about emotional intelligence, we don't actually train ourselves on this. Many years ago, I was actually brought into schools in London, a team of us, to train students on emotional health, understanding yourself, having that basic understanding of how you feel, and then how you manage your feelings, and how you then think about how your feelings can impact on others, and certain social skills. But in Nigeria, we don't value this social and emotional learning. We get into academics, and then we think that when situations happen to us that are impacting our health, I don't know, probably the faith groups are there, but we don't value this basic talking about things like that, and we need to talk about them.
What would you recommend? At what age do you think we should begin to teach our children emotional intelligence? Maybe from school?
From primary school. As I said, there they had a team that decided, they want to improve adult mental health, and they need to start from childhood. And they were teaching primary school children's basic feelings. I feel happy, I feel sad, how to deal with it. So we need to start from primary school. And then particularly in secondary school, because we are training teenagers to become young adults. And if we're not training them on the emotional, social side of learning, they will go into the work, into the real world of work and relationships, not having those skills to deal with each other.
Yeah, definitely. Okay, so we can go to the phone line.
All right, so we'll trade up the phone lines open right now, so you can be part of the conversation by calling us up, asking questions in regards to the conversation here. You can also send us messages to WhatsApp, lend a voice to the conversation here by contributing to the topic of discussion, investing in mental health. We'll take a break. We'll be back in a moment. In our studio this morning, we have Chinyarugo Densi, a clinical psychologist at Neem Foundation. Well, she's at Neem Sanctuary, and she'll give you a number and an email to reach at the end of the conversation for psychological support. We have in the studio as well, Yumi Oloko.
Yep.
Yes, he's a trainer. I mean, so far I've been enjoying the conversation. I think it's the same with one of our listeners who sent a message this morning. Jemima is in Kubwa, says, thank you very much for this program. I really enjoy it. I really enjoy listening to it every Wednesday at 8 o'clock. But how can I improve my mental health when I'm in a toxic workplace?
I would like to say, Jemima, how are you? I would like to say that one of the greatest resources we have now is our phone. Just Google. In fact, just Google that. How can I improve my mental health in a toxic workspace? And probably put free resources. A load of things will come up. There's so many resources. CBT was supposed to be a self-help program anyway, cognitive behavior therapy. There are lots of things you can find on the web that are useful that would help you.
All right. This other one here, no name, says, at the beginning of the year, I set out with my New Year resolution to be happy. But a lot has happened, and I've battled and struggled with happiness all through till this point. Any recommendations as to how I can be happier?
Okay, it's quite. I think, happiness is quite subjective. It's a personal experience. And sometimes we think that when we check certain boxes or when we do certain things, then we'll be happy. I guess at the end of the day, it's a personal journey of you have to make a choice to be happy. And if you're finding that you're struggling to find that within yourself, to find the happiness within yourself, then you might want to speak to somebody that will help you understand and discover what the problem is and how you can get onto that journey. But at the end of the day, you may want to, if it's something within your control, you want to be able to generate it internally and want it for yourself. But if you're really struggling, which some people can be struggling with, beginning of the year till now, it's been a very long time, and if you still feel like you're not able to find that, you're going to get a number at the end of the conversation that you can just call, and we can help you understand what's going on and help you discover happiness again.
All right.
So I wanted to ask Mr. Yomi, we've been talking about investing in mental health as a family and community, and surely there's some hindrances when it comes to investing in mental health. What are these hindrances that we can experience, and how can we get past it? Because we need to invest in our mental health. So what can we do as a family? What can we do as a community to get going? Okay.
I was probably say on a family level, individual family level, I think one of the greatest hindrances is that we need to develop, it's been alluded to, social, emotional intelligence skills. We need to, each of us need to take responsibility to say, I'm going to develop my social and emotional learning. I'm going to learn more about myself. So as I know more about myself, I can give to others, because if you don't know anything about yourself, or you're very poor at managing yourself, it will be difficult to give to others. Yeah. I do believe that. And I also believe on a family level, as I've said, parents need to be more, we're now in the 21st century. Young people know what they want to do. They have life choices that they need to make, and parents need to support them, even if they feel they may not necessarily have to agree on them. They have to help support their teenagers to become compassionate adults. So, yeah. On the community level, as I just said, I think we just need to invest more in creating opportunities for greater lay counseling training. And providing other resources, making them known, making them accessible, but also starting in schools as well.
All right, so wrapping up the conversation for this morning.
Yes. Mr. Yemi, would you like to wrap up for us?
Yep, I'm just conscious. So I said we need to do more work in schools. I actually run a program whereby we train teachers on developing their emotional health and well-being so that they can then transfer these things onto children. And children are going back, teenager children are going back after being indoors for 6 months, and they are bound to have loads of emotional issues. So I think we need to look at how we help teachers deal with that.
From my point of view, the family and community, like we mentioned, they play a very big role in our ability to function within society. In the skills we learn, the connections we build, they play quite a huge role. For a very long time, we've had quite a close community in Nigeria. Nigeria or Africa, most African countries are seen as, we're very community-based. And we want to build on that strength that we have as community, as family, to look out for each other, to help each other. There's a Southern African term called Ubuntu, which is about you, which means that you are, I am because you are. So we need to form some form of connection with each other, where we are there to support each other, to look out for each other, excuse me, and to ensure that, within the family and within the community, we're doing our best, we're being our best for ourselves. And this call right here, someone is going on a one-way street and you're not supposed to. Things like this speak to the, to the sense of community, looking out for each other, doing the things that we need to do to ensure that our well-being, are being taken care of.
All right, well said. Yeah, well said. Before we go, let's leave you with a number and an email address. You can reach us up until we're back in the studio.
Yes. All right. For psychological support, please call us on 0706 062 5054. I'm going to call that number again. 0706 062 5054. And please remember that the number is only for psychological support at Neem Foundation.
Thank you very much, Chinyergo Densi from Neem Foundation. Also, thank you very much, our guest here in the studio, community mental health and lay counseling trainer, Yomi Oloko. It was very, very glad to have you here in the studio.
Thank you.